Number of receptors are maximum compared to any part of your body in the hand. We call it as motor homunculus. So most of integrated therapies I use hand. So the way you eat, if you are doing this one, it means samana mudra. It means this one mudra already I taught you. Samana mudra. Samana mudra is I want to balance all the 5 constitutions of my body equally. Whatever is more, whatever is less, let it get corrected automatically. If it works, I don't know how it works. If you ask me, give me research evidence, no. You should do some research evidence and tell me. But this is a samana mudra you can do. You can do this 5 minutes morning, 5 minutes evening. Just it will help you as a defocusing technique. I'll come to that. Okay. So in our body there are 2 control mechanisms. One which is, just now you did something to move, which is under your control, is voluntary nervous system. Now I request you to stop your heartbeat for some time. So it means there is something in our body which cannot be controlled by our logical mind, is involuntary nervous system. In our involuntary nervous system, again it is divided into 2 categories: sympathetic nervous system and parasympathetic nervous system. Sympathetic means, for example, you are sitting all relaxing, sitting quietly. Now also I am little comfortable now, so I feel a little comfortable zone now. In this comfortable zone, there is a big snake. Python comes and from somewhere from the top it comes and bang. You will see that. What will be your response if you see a big snake here? Yeah. What exactly happens there?
Panic.
Excited. It is your body's control mechanism which is designed to protect your body. We call it as a survival response. For me to survive, I have to be alert. For me to be alert, either I have to kill that particular snake or I have to run away. These 2 I can do. This is called as fight or flight response. It's very, very interesting. I'll connect this with your diabetes. Fight or flight response. What happens? My heart rate increases, my blood pressure increases. Why? My body has to either fight or I have to run away. For me to run away, my muscles has to be working fast. So there will be pooling of blood from the center part of your body towards skeletal muscles. More blood supply towards the skeleton. So there will be stiffness. Heart rate will increase because it has to pump more blood. More blood is required, your breathing has to be increased. Breathing will increase. You note down, heart rate increases, blood pressure increases, your muscles will become tight, your breathing increases, you will become more alert. You will not be so easy, you will not be so much comfortable. You will become more alert. And there will be pooling of blood from the digestive system, mainly from the stomach towards the skeletal muscles. So this we call it as stress response.
It's a state of panic.
It's a state of panic. It is a protective response. In animals we call it as a survival response. In human being we call it as a stress response. So there is one more important thing happening, is your liver is started to work more. Glycogen from the liver is getting to convert more towards glucose, and blood sugar will increase. So note down this. Sympathetic activity, blood sugar will increase. So in this activity. So ancient times, unless I see a snake or a tiger or something else, I used to get panic. But modern times are not like this. Even if I am sitting in a traffic, I still feel the same response as that of seeing a snake, because body does not understand. What body does? Body does the same mechanism or same functioning as that of if I see a tiger, if I see a snake. Body does the same, just by mind assumes that, for example, you are sitting in a traffic. What you are experiencing is exactly the same like how you are seeing a tiger or a snake. So this kind of sympathetic overactivity is happening, and that is a major cause of diabetes. So whatever we discuss, whatever alternative therapies, whatever medicines, whatever alternative home remedies I tell, unless I don't tell this. Yes? Yes?
So we have to be away from life, slow down in life.
Yeah. So I'll come to that point. So that is sympathetic overactivity. Other part of that, if you kill the snake or if you run away from the snake, what happens to your body? Again it goes back into a phase of relaxation. Your increased heartbeat will become normal,